respiratory system. So about the larynx, what do you know about the larynx?
It's a
It's
voice
yeah, small spots.
Larynx.
It's contain a cartilage called epiglottis.
It is cartilage and
Muscles.
Opening
muscles and fibroelastic membrane and some ligament. So it is a structure that it is going to be formed by some of the cartilage, some muscle, some membrane, and some ligament. Okay? And also neurovascular fiber. Where is the location of the larynx?
at the top of
At the
trachea.
beginning of the trachea. So at the opening of the superior portion of the trachea, we are going to explain for you the larynx, the structure of the larynx. And you know the larynx consists of the cartilage, muscle, membrane, and ligament. So at the proximal end of the trachea, we are going to introduce to you the larynx. Inferior to the larynx, the trachea is going to descend. The trachea consists of some C4 or U4 cartilage. The trachea is around 10 to 12 centimeters. So the trachea is about 10 to 12 centimeters. The pharynx is visible here. The superior portion of the pharynx is posterior to the nasal cavity. We call nasopharynx. In the middle part of the pharynx, this part of the pharynx is visible posterior to the larynx, to the oral cavity. We call oropharynx. And inferior portion we can call laryngopharynx. You should know that the pharynx inferiorly is going to be continued to esophagus. Superior to esophagus, the pharynx consists of three portions: the laryngopharynx, the oropharynx, and nasopharynx. Look at here. Inferior to the larynx, I am able to show you the trachea. So inferior to the larynx, the trachea is visible. In this picture, you are going to look at some of the laryngeal cartilage. Have you ever heard the thyroid cartilage? This is the thyroid cartilage. One of the single cartilage that participate to form the larynx, and it is the largest cartilage. Thyroid cartilage is the largest cartilage that belongs to the larynx. Look at the thyroid cartilage. It consists of two lamina. These two plates, these two lamina, anteriorly fuse to each other, make a angle. This angle between these two laminas, between these two plates, in the male sex is around 90 degrees, but in female sex is around 120. So the attachment of the lamina in right and left side anteriorly here make the laryngeal prominence, make the Adam's apple. Have you ever heard Adam's apple?
Yes. Mm-hmm.
Adam's apple is visible here. Here. Exactly. It is the laryngeal prominence. That prominence or project anteriorly. It is the attachment of the left and right lamina of the thyroid cartilage. Between these two lamina posteriorly, we have the angle. This angle in the male sex is around 90 degrees, in the female sex it is wider, it is around 120. So the Adam's apple in the male sex, the Adam's prominence is more larger than in the female. Okay? When you are going to swallow, this Adam's apple is going up and down, and it is visible to you. It is visible, and this prominence in the male sex is larger than the female sex, but it is possible in some of the female sex, this connection, this angle is such as the male sex. So the Adam's apple in the female sex also can be such as the male sex. Prominence anteriorly such as the male sex. Inferior to the thyroid cartilage, another single cartilage that belongs to the larynx, we call the cricoid cartilage. Cricoid cartilage is visible here. One of the muscles that participate to form the larynx is visible here. Now, in this picture, you are going to look up to the pharynx from posteriorly. Means we prepare a coronal section, rotate to you. So you are going to look up to posterior surface of the pharynx. You are going to look at to posterior surface of the pharynx. Some of the muscles are visible here. This rough is the connection, the fusion of the muscle in right and left side in the midline. If you cut this rough, if you cut this midline, we will be able to show you this picture. You are going to look at the pharynx from posteriorly. We cut the rough and open the muscle. So I am able to show you the nasopharynx here, exactly posterior to the posterior nasal orifice. What's the name of posterior nasal orifice? Quana. We remember nose rib, quana. We are going to look at to the pharynx. Pharynx is posterior to the nasal cavity, posterior to the oral cavity, posterior to the larynx. And the pharynx inferiorly is going to be continued to esophagus. The pharynx consists of three portions. Superior portion is posterior to the quana, posterior to the nasal cavity. This portion, this part we call the nasopharynx. The middle portion of the pharynx is exactly posterior to the oral cavity. We call the oropharynx. And inferior to oropharynx, we are going to show you the laryngopharynx. Laryngopharynx is a small portion of the pharynx, exactly posterior to the larynx. Okay? And the pharynx inferiorly is going to be continued to esophagus. Now look at to nasopharynx. Nasopharynx we are going to explain for you in digestive system completely about the pharynx. We explain for you everything detailed in the esophagus, in the digestive system. But if you look at to the nasopharynx, in each side of the quana, we are able to show you a foramen. This foramen is going to be continued to Eustachian tube. Have you ever heard Eustachian tube?
Yes.
Or tympanic tube? In here, the Eustachian tube, the tympanic tube, here is going to open to nasopharynx. And in the other end, it is going to open in middle ear. Okay? When you are going to the airplane, at the first, it is better you swallow or you use a chocolate. If you put the chocolate in your mouth, it is going to help to you that your ear never get problem. Okay? What happened? Because this Eustachian tube, one end is going to open here and one end is going to open to the middle ear. So you are going to balance the pressure of the air pressure of the vessel in both sides of the tympanic membrane. Okay? With using the chocolate before taking off, it is going to help to you that you balance the pressure of the air, pressure of the vessel in both sides of the tympanic membrane. Now, look at to this picture. In this picture, you are going to look at to the pharynx, and here is the laryngopharynx. In the structure of the larynx, we are able to explain to you 3 pair of the cartilage and 3 single cartilage. How many cartilage are going to form the larynx?
3, 6, 7.
9. 3 single and 3 pair. So we have 9 cartilage in the larynx, 3 single cartilage and 3 pair of the cartilage. About the single cartilage, the largest one is the thyroid cartilage. Another single cartilage is cricoid cartilage. And another single cartilage is epiglobe. Epiglobe, thyroid, cricoid. This thyroid cartilage is the largest cartilage in the larynx. The thyroid cartilage, as I explained for you, consists of 2 lamina anteriorly fuse to each other and make the Adam's apple or laryngeal prominence. Posteriorly, each lamina consists of 2 horns, superior horn or horn and inferior horn. Which of the horns is longer, superior horn or inferior?
Superior.
Superior horn. The thyroid cartilage consists of the superior border and inferior border. The superior border of the thyroid cartilage is going to connect by a fibroelastic membrane to this bone. What's the name of this bone? Hyoid bone. Hyoid bone is a single bone in the base of the tongue. So the hyoid bone, the position is superior to the thyroid cartilage. Between the thyroid cartilage and the hyoid bone, you are able to find a membrane. It is a fibroelastic membrane. This fibroelastic membrane we can call thyrohyoid membrane. We can call thyrohyoid membrane. The name is coming from the thyroid cartilage and the hyoid bone. Thyrohyoid membrane. Do you get everything? This thyrohyoid membrane is fibroelastic. In each side, in the thyrohyoid membrane, we are able to show you a foramen. Through this foramen, some of the neuromuscular structure are passing, and it is important. In the last semester, one of the questions was about this foramen in each side. I asked from the student that which of the following nerve is passing through this foramen, or which of the following artery is passing through this foramen. So this foramen is visible in each side of the thyrohyoid membrane, and it is important that you know which structure are passing. Later, I am going to introduce to you these arteries and these nerves that are passing through this foramen. If you look at the thyrohyoid membrane, in the median part, in the central part, it is going to get dense and make a ligament that we can call thyro or median thyrohyoid ligament. Median thyrohyoid ligament, the central part, the median part of this membrane is going to get dense and make a ligament. What's the name of this ligament? Hyoid ligament. Between the superior horn and the hyoid bone, again in the lateral, this thyrohyoid membrane laterally again is going to get dense and make the lateral thyrohyoid ligament. How many lateral thyrohyoid ligaments? Two. How many median thyrohyoid ligaments? One. Now, about the inferior bone, it is shorter than the superior bone. The inferior bone is going to make joint with this cartilage. What's the name of this cartilage? Cricoid cartilage. Cricoid cartilage is such as a ring. When you are going to look at a ring, the ring consists of a lamina and an arch. Okay? About the cricoid, this arch is anteriorly and the lamina is posteriorly. So you are going to look at to the larynx anteriorly. Which part of the cricoid is visible here? Arch. If I want to show you the lamina of this ring, lamina of this cartilage, I should go posteriorly or rotate the larynx. So inferior to the thyroid cartilage, we have another single cartilage. The name of this cartilage is cricoid cartilage. This cricoid cartilage is such as a ring, consists of the arch and posteriorly consists of a lamina. Okay? Do you get that? Between the arch and the thyroid cartilage, here we are able to show you another ligament or another membrane that we can call cricothyroid ligament or cricothyroid membrane. Okay? So it is cricothyroid membrane, it is cricothyroid membrane. About the cricothyroid membrane, again in the median, in the midline, it is going to change to dense and make the cricothyroid ligament, median cricothyroid ligament. In some of the texts, it is possible to the cricothyroid, median cricothyroid membrane, it is possible they wrote the conus elasticus. Conus elasticus is another name of the median cricothyroid ligament. If some problem happens and something go to the airway and may close the airway superiorly, how we can help to this patient? It is possible we be able to cut the trachea and pass a tubule, a temporary tubule to take this patient to the emergency room. Okay? You put a tubule here, the air is passing through the tubule, go to the lungs, because in this patient, something coming and passing through the air and stop here. And so the air is not passing here. To help to this patient, we cut the trachea or we can cut this conus elasticus, this median cricothyroid ligament. Both of them is going to be helpful. You cut and put a tubule, a temporary tubule, take this patient to the nearest emergency room. Okay? Now, about the cricothyroid later, I'm going to use another term. Just now, I tell to you that this membrane or this ligament is cricothyroid membrane or cricothyroid ligament. Later, I'm going to use another name. The inferior horn of the thyroid cartilage is going to make joint with the cricoid cartilage. Here we have a joint. Okay? This joint helps to the thyroid cartilage to go forward and inferiorly during the swelling, during the sticking. This thyroid cartilage can go forward and downward, go forward and inferiorly downward along over this joint. What's the name of this joint between the inferior wall of the cartilage, thyroid cartilage and the cricoid cartilage? Now here, which cartilage is visible?
Thyroid.
Here is the superior border. Is it correct if I explain for you in inferior border, inferior margin of the thyroid cartilage, I am able to show you a notch that we can call superior thyroid notch. Okay? This superior thyroid notch and this Adam's apple is palpable in surface anatomy. You are able to palpate, to feel the Adam's apple and superior thyroid notch in your body. Now in this picture, you are going to look at to the right and left lamina. What's the name of this laryngeal protuberance?
Laryngeal
Adam's apple, superior horn, inferior horn. If you look at to the lateral view, to the external surface of each lamina, here I am able to show you an oblique line. This oblique line is visible also here, oblique line in each side. This oblique line is an area for attachment of three muscles. Three muscles are going to attach to oblique line. The inferior constrictor of the pharynx. The inferior constrictor of the pharynx, it is a muscle in each side, attached here. The sternothyroid muscle, sternothyroid muscle, the thyroid muscle. So look at here, the sternothyroid, the thyroid muscle. How many muscles is going to attach to this oblique line?
6.
Three.
Three in each side. Give me the name of these three. The sternothyroid, thyroid, and inferior pharyngeal constrictor. Now this oblique line in your book, you find that superiorly and inferiorly, we are going to find a two vector. This oblique line, each side, inferiorly and superiorly, they are going to change to the two vector. Here, again, the oblique line is visible. The superior two vector, the inferior two vector is visible. What's the name of this ligament?
Thyroid.
Median. Thyroid ligament. What's the name of this ligament?
Lateral.
Thyroid. What's the name of this ligament? Median. We call thyroid ligament or conus elasticus. Conus elasticus. Do you have any question?
I just have one question. Why is it that where the superior notch of the thyroid ligament is located, we say this is the inferior border?
Okay.
Where the notch is, that border, you said is correct?
It is the notch and it is superior notch of the thyroid cartilage.
You said that's that border, it's correct to say inferior border.
I told you.
Okay, I must have misunderstood, sorry.
No, it is the superior border and here is the inferior border. Okay? The superior border here is visible and here I am able to show you a notch. This notch is visible in superior border. Okay? Now here you are going to look at to the neck anteriorly, thyroid cartilage, thyroid gland, cricoid cartilage, and these muscles are visible here, sternothyroid and thyroid. This oblique line, sternothyroid and thyroid are visible in this picture. We are going to look at to the larynx posteriorly. This picture is going to help to you to find another single cartilage in the larynx. What's the name of that?
Epiglottis.
Epiglottis. It is such as the spoon. It is leaf-like cartilage. It is a triangle, leaf-like cartilage. This epiglottis has a body that it is wide and has a stalk that it is narrow. The epiglottis inferiorly is going to attach to the thyroid cartilage. To which surface of thyroid cartilage, anteriorly or posteriorly? Posteriorly. So, inferiorly, the epiglottis is going to get narrow and attached to the posterior surface of the thyroid cartilage. Superiorly, the anterior surface of the epiglottis is going to attach to posterior surface of the hyoid bone. So the epiglottis here is going to attach to the thyroid cartilage and to the hyoid bone. The ligaments are going to attach the epiglottis to hyoid bone and to the thyroid cartilage. This ligament we can call thyroepiglottic ligament, and this ligament that attach to the anterior surface of the epiglottis and posterior surface of the hyoid bone we can call hyoepiglottic ligament. Okay? So if you imagine here you have the hyoid bone and here we have the hyoid cartilage. The epiglottis is here. Inferiorly, it is going to attach to thyroid cartilage via a ligament. What's the name of this ligament? Thyroepiglottic ligament. Here, if you imagine, we have the hyoid bone. Between the hyoid bone and anterior surface of the epiglottis, we have another ligament. What's the name of this ligament? Hyoepiglottic ligament. Okay? Hyoepiglottic ligament. So the epiglottis, the thyroid, the cricoid are a single cartilage in the larynx. How we can find it is the posterior view of the cricoid cartilage? About the cricoid cartilage. How can I find it is the posterior view of the cricoid cartilage? Because the lamina is visible here. I told you the cricoid is such as a ring, that the lamina is posteriorly. Look at the lamina, it is here. But anteriorly, you are going to look at to the arc of the cricoid cartilage. Okay? Now, when you are going to swallow, when you are eating, you know the pharynx is a tubule that during the swallowing, the food is passing. During the breathing, the air is passing. Okay? So it is better when you are eating, never speak. Because you are going to make problem. Only one of them can pass easily and fast without any problem. Food or air. If you are swallowing, start to speak, it is going to make problem. It is possible. A small particle of this food go inside of the airway and you are going to do the coughing. Okay? Do you get that?
Yes. I just have one question. Those two cartilage near the inferior, what are they called?
Later. Just now I explained for you 3 single cartilage. Epiglottis, thyroid, cricoid. I told you how many pair of the cartilage we have? 3. So here in this view I am able to show you the 3 pair of the cartilage that participate to form the larynx. One of them is pyramid shape. We call arytenoid. Arytenoid, the base of arytenoid is going to make joint with the lamina of the cricoid cartilage. Means here is the lamina of cricoid cartilage. Superior border of the lamina, in each side you have the articular facet. This articular facet is superior border of the lamina of cricoid, is going to make joint with the base of the arytenoid cartilage. This joint is a kind of synovial joint. Means if you imagine here is the arytenoid and here is the superior border of the lamina of cricoid, this joint is a kind of synovial joint. So they are going to slide in here. They are going to help to you to go far from each other, the vocal fold, or go close to each other. Because the vocal fold are going to attach to arytenoid cartilage. With sliding of the arytenoid, vocal fold or vocal fold, the position change. They are going to do adduction or go abduction. Go close to each other or go far from each other. Later I'm going to speak in detail about this. What's the name of this pair of the cartilage? Arytenoid. This arytenoid is pyramidal shape. Consists of three surfaces. One of the surface is anteriorly. One of the surface is medially, and one of the surface is posteriorly. Here we are able to show you the medial surface, posterior surface, and anterior surface. In the apex of the arytenoid, you are going to find a small cartilage. In the apex of the arytenoid in each side, I am able to show you a small cartilage. This cartilage we call corniculate. And in the apex of the corniculate in each side, we are able to show you a small cartilage that we can call cuneiform cartilage. So the pyramidal shape of the arytenoid, inferior, it is going to make joint with the lamina of the cricoid cartilage. At the apex of each arytenoid, we are able to show you a small cartilage. What's the name of this cartilage? Corniculate. And at the apex of corniculate here, you are able to find another cartilage that we call cuneiform. So how many cuneiform we have in the larynx? 2. How many corniculate?
2.
How many epigloss?
1.
Between the pair of the cartilage, which of them is the smallest?
The
Which of them is the largest? Between the pair.
this is
Between all of them, which of them is the largest?
thyroid.
Which of them is the lowest?
Cornicoid.
No. Cricoid. Cricoid is the lowest. Yes? Lowest compared to all of the cartilage. You get that?
Yes.
Largest is thyroid. Between the pair of the cartilage, the largest is arytenoid. Between the pair of the cartilage, the smallest is cuneiform. The inferior cartilage is cricoid. Here, you are going to look at the cricoid cartilage. If you notice the cricoid cartilage, the arc of this ring 4 cartilage is anteriorly. The lamina of this ring 4 cartilage position is posteriorly. In the superior border of the lamina, we have an articular facet. It is going to make joint with the base of the arytenoid cartilage. Each arytenoid cartilage consists of 3 surfaces. anterior surface, medial surface, and posterior surface. Look at the anterior surface of arytenoid. A crest is going to divide the anterior surface to two areas, to two fossa, superior area or fossa and inferior area. Superior fossa or area and inferior area or fossa. In the base of the arytenoid, we are able to show you here three angles. One of the angles project anteriorly and medially. We can call vocal, here we can call vocal process. Another angle here we can call muscular process. Vocal process, muscular process, okay? And another angle don't have a special name. So the base of the arytenoid cartilage, two of the process are visible, vocal process and muscular process. What's the name of this surface of arytenoid? Anterior surface. A crest is going to divide the anterior surface to superior fossa or area and inferior fossa or area. Okay? Now, look at the lamina. Here. What do you think? Which surface of lamina is visible here?
The posterior.
Anterior or posterior? In posterior surface of the lamina, that it is here, it is the arm and it is the posterior surface of the lamina. In the midline, I am able to show you a vertical crest. A vertical crest. The esophagus is going to attach to this vertical crest of the cricoid. In each side of this vertical crest, I am able to show you a depression, a concave area, a depression. This concave area is the site for attachment of a muscle. What's the name of this muscle? We can call lateral cricoarytenoid muscle. Lateral cricoarytenoid muscle, posterior cricoarytenoid muscle. We can call the posterior cricoarytenoid muscle. So posterior cricoarytenoid muscle is going to attach to the lamina of the cricoid. To which surface of the lamina? Posterior surface. This posterior cricoarytenoid muscle is going to attach here and it is going to have insertion. The insertion is going to attach to muscular process of the arytenoid cartilage. Look at here. Here you are going to look at the cricoid and arytenoid cartilage. Here is the muscular process. Posterior to this lamina, we can explain in each side a muscle. What's the name of this muscle? Cricoarytenoid muscle. The origin of cricoarytenoid muscle, the origin is the lamina, the posterior surface of the lamina of cricoid, and the insertion is muscular process. What do you think? Imagine. What is going to explain, if you want to explain the function of posterior cricoarytenoid muscle, what is the function?
It moves this. It moves these cartilages to the inferior and that, or laterally, and it changes for the sound to make voice.
It is going to look at here. This vocal process is a site for attachment of vocal fold or vocal cord, and this muscular process is a site, an area for attachment of some muscles, such as the cricoarytenoid posterior muscle. This cricoposterior arytenoid muscle is going to insert to the muscular process. So it is going to rotate the arytenoid laterally, not medially. When the arytenoid rotates laterally, if we imagine here we have the vocal process and here is this little finger is the muscular process, then this muscle is going to attach here, so rotate the arachnoid laterally, okay? So the vocal cord go far from each other and the larynx is going to get open, okay? Now, again, look at here. It is going to remember you. Here, we have going to show you the lamina of the cricoid, the posterior view. This impression, this depression is the site for origin of each muscle. Posterior cricoarticular muscle. Origin is here. Insertion is here. So they rotate laterally the arachnoid cartilage and the vocal folds go far from each other. 15 minutes break.